This is Jeff Zeig, and here I am in my office in Phoenix, Arizona. The office is the Milton Erickson Foundation with another 5-minute tip for therapists. A tip here is hypnosis. This is the topic of this 5-minute video. I recommend that every therapist learn hypnosis. Now, I've been studying and challenging myself to master something about hypnosis over the last more than 40 years. I wouldn't expect that other people would be so avid and so interested. But hypnosis teaches people about evocative communication. It teaches people to use all of the output channels of communication to have an effect on another person. Hypnosis is a metaphor. Now, most traditional hypnosis is taught as a technique. You do an induction, then you do a deepening technique, then you do therapy suggestions, then you do reorientation suggestions. This model of hypnosis is outside in. It's as if the operator is putting into the passive subject suggestions or taking out of the passive subject ideas that don't seem to work. So hypnosis is commonly thought of as a technique, like it's a medical technique, like here's a technique for how to set a bone, or here's the technique that you use if the person has an infection. You apply the technique. I understand that this is in vogue and that people commonly think, okay, if the patient has depression, apply this technique, hypnotic technique. If the patient has a social phobia, apply this technique. But I think of hypnosis as more of an orientation to how to communicate to the human heart, how to communicate in such a way that the communication that you use is more three-dimensional, more vibrant, and hence more effective. Hypnosis in orientation, it's a way of being with another person. Hypnosis is a relationship. Hypnosis is not a way in which one person manipulates another person. It's a way of understanding how human beings function, how human beings respond to meaning, and developing a fertile bed of responsiveness. Now, in psychotherapy, well, maybe in life some people would say you can't have enough love, or some people might say you can't have enough money, but in hypnosis, in the hypnosis world, you can't have enough responsiveness. The purpose of an induction of hypnosis is to build responsiveness. In a situation where people are responding, then they're more able to actualize what it is that they need to do to help themselves live in a more adaptive way. So I recommend that in the study of hypnosis, it's not a matter of memorizing an induction technique. When I started doing hypnosis in 1972, I was learning induction techniques. I was learning a script, how to do that script in such a way that it would lead to a response that I could deem hypnotic. Now what I do is I deconstruct hypnosis. I understand the components of hypnosis. Hypnosis is a category, and that category is becomes a conceptual reality when you orient to components. There's a book that's available from the Erickson Foundation Press, Hypnotic Induction, which explains my model of hypnosis based on 5 different points. How can you help somebody to modify their attention, to alter the intensity of their experience, to realize dissociation, to respond to the meaning of communication in a context that is defined implicitly or openly as hypnosis. So I invent a new induction for every patient. I invent an induction that is relevant to the patient and the patient's goals. And I do that because I understand the principles that are involved. It's not a matter of applying a technique and thinking that hypnosis cures anything. I don't think about hypnosis as curing anything. I think of hypnosis as a way of communicating in such a way that it builds an adaptive responsiveness that can be harnessed by someone in order to transform themselves, to transport themselves, to take themselves into a place that is a more adaptive way of being in the world. I recommend to you Hypnotic Induction, which is available from the Erickson Foundation Press. This is Jeff Zeig, Phoenix, Arizona, with another 5-minute video. Hi, I'm Jeff Zeig, and I'm the founder and director of the Milton Erickson Foundation, and here I am in our training room, and behind me is a gallery of photographs. These are photographs of people who have attended our intensive training program. That's what I'd like to tell you about. Our intensive training program, 1 week of fundamental, 1 week of intermediate, 1 week of advanced, is being held in July this year in this training room in Phoenix, Arizona. People come literally from all around the world because the Erickson Foundation is a center for learning about contemporary approaches to hypnotherapy based on the work of Milton Erickson. And when you're here, you also have the opportunity to go to the Milton Erickson residence, the historical residence, which is a museum. You can see where Erickson lived. You can see where he practiced. You can see where he brought up some of the members of his family, along with Mrs. Erickson. You have an opportunity to see the things that are written about in books about Erickson, going to the botanical gardens, climbing Squaw Peak, visiting the Heard Museum, typical things that Erickson would suggest for various therapeutic and symbolic reasons to the clients who came. So I want to invite you to be here in July for 3 weeks of our training. The first 2 weeks, 1 week of fundamental, 1 week of intermediate. The primary faculty for these 2 weeks is Dr. Brent Geary, who is, I think, one of the best teachers of fundamental hypnosis in the world, and also myself and Lillian Borges. We will teach components of the fundamental and intermediate. The third week is an advanced week. We only have this advanced week one time every year. It'll be at the end of July. And primarily, I teach the advanced week along with Steve Langton, who's an incredible teacher and the editor of the American Journal of Clinical Hypnosis. Steve is somebody who I've known literally for 50 years and has been a friend and an esteemed colleague. So I hope that you can join us here in July. Some people decide that they'll just take 1 week, some people take 2 weeks, some people stay for all 3 weeks. And we have the intensives 3 times a year, in the spring, in the summer, and in the fall. So lots of people choose to take 1 week and practice and then come back and take another week, or if it suits you, come for all 3 weeks. It's a wonderful training experience. It's a great environment. It's an opportunity to meet colleagues from around the world and an opportunity to learn about the model that we teach here at the Erickson Foundation. Even if you've taken a fundamental course before, come to our fundamental course, learn about our model. Our model is really based in what I saw about Milton Erickson. Welcome you to the Phoenix Intensive Training Program from the Milton Erickson Foundation, July 2018, in this training room in Phoenix, Arizona. Look forward to seeing you.